Hi, we're here with Dr. Tamyra Comeaux. Dr. Comeaux is board certified in OBGYN. She is board certified in anti-aging and regenerative medicine, board certified in integrative cancer care. She is an herbalist and essential oilist and specializes in a lot of things. And she's a big part of our wellness program here at Radiance. So Dr. Comeaux, you and I both had very traditional Western medicine training and practiced myself in family practice and internal medicine before I got into functional medicine and medical aesthetics. Explain the difference in functional medicine and traditional medicine.
Right. So I practice like functional integrative. Functional is like, why are you having a problem, and let me address that. And traditional is, you must actually have the problem now. Like I treat a lot of people who are insulin resistant and pre-diabetic, and regular medicine doesn't really have a lot to say about that. I mean, maybe they'll tell you to eat less sugar, but they're all a path on the way to diabetes. So most people don't get a medication until they get to diabetes. Whereas I will find you and say, you're going to get diabetes, so let's do something now. I might prescribe something to you. I might have a lot of different natural things that we're going to do. But at the end of the day, I'm trying to make sure you don't get diabetes. Whereas traditional medicine is like, come back when your sugar's high, now we're gonna have fun. So I intervene at a very different time than they do. So, and when I was practicing traditional medicine, I was often frustrated by that type of approach to medication, or practice, because insurance companies don't pay me to go on a fishing expedition to figure out all this stuff and draw labs to figure out things that don't exist. They don't actually reimburse if you don't have the disease, even though I can look at you and tell you're at risk. So functional medicine, I get to have more latitude in figuring out predicting what's going to happen. I can look at your family history and what's going on with you now and say, these are what might be coming down the pike for you. Let's do this. This is natural. This is easy. Here's an herb. Why don't you incorporate that? And then maybe later you won't end up like your parents. So, functional integrative medicine gives me a lot more leeway to try to deal with that. And if you even have the disease, a lot of times regular medicine will give you a drug, but I'll say, well, that disease comes with a vitamin deficiency. The drug does not get you out of needing to address that. Matter of fact, not addressing that might lead you to 4 more problems that you do not want drugs for, so let's deal with that. Like, for instance, I treat a lot of osteoporosis. As a gynecologist, women come to me with bone loss. So if you go to your regular doctor, they'll say, hi, here's a bisphosphonate, or whatever drug they're using nowadays for that. And I don't normally treat with that anymore because people are already coming to me from other physicians on it. But I'll say, well, did they tell you to take calcium or vitamin D or magnesium, or are you taking collagen? I mean, I've come up with this whole list of things that the patient isn't doing. And I'll say, that drug did not get you out of the fact that you need to feed your bones the food they like. So, that's the different approaches. I'm trying to actually get you to create healthy bone, or even hormones. Men have testosterone. They rarely suffer from osteoporosis. That hormone is very protective of your bones. Even when women have estrogen, their bones aren't at risk like when they don't have estrogen. So we just do a lot of different things to address the problem that aren't the drug that waits until you really you're deep in the doo-doo.
Right. So if you'd like to see Dr. Comeaux, give us a call here at Radiance.